And the CDC expects the fall and winter respiratory disease season in the United States to have a similar number of combined peak hospitalizations due to COVID-19, influenza, and RSV compared to last season. The CDC updates this outlook every 2 months throughout the season and as warranted by changes in the trajectories of any of the three diseases. Flu season is in 2025-2026, started last month. It's expected to run through May of next year. And joining us now is Dr. Hector Ocarranza, El Paso City and County Health Authority. And Dr. Ocarranza, thank you so much for taking the time and joining us today. We just talked about the timing of flu and respiratory disease season. As far as us here locally and the timing of it all, is that timing any different in El Paso? And maybe what are some of the trends that you're seeing here locally?
Well, thank you very much, Andy, for having me. And what we see here in El Paso is that our flu season starts probably at the end of October and it lasts all the way to probably end of March, April. It sometimes doesn't mirror exactly what they see nationwide because this virus starts coming and attacking the East Coast. Also, have some cases of the flu in the West Coast, and that is a good thing for us because we're kind of in the middle and we see what happens and we start seeing the trends of how the flu and the COVID and RSV start behaving in other parts of the country, and that gives us time to prepare and to continue telling the public what are the recommendations that we're trying to give them and how they need to be staying healthy, especially with this holiday season that are just coming really rapidly.
Yeah, it'll be here before you know it. And when it comes to vaccinations, we heard so much about the COVID vaccine, of course, during the pandemic and its importance. But the last couple of years after the World Health Organization declared the end to the public health emergency, we haven't heard as much about it since. Is it still important to get the COVID vaccine, the flu shot, or perhaps even both?
Well, definitely, even though if we don't hear much about it, I know that people are trying to make controversy out of the vaccinations, but it is important for people to get the vaccination. And in particular, the people that have chronic conditions, those people that have a weak immune system, we strongly recommend the flu and RSV vaccine for the young infants and also for elderly, because those are the ones that have a higher rates of hospitalization. We saw how the COVID vaccine prevented many of the hospitalizations that we saw here in El Paso, and that was the main reason why we saw those rates of COVID dropping so rapidly, because we were one of the first cities in the state and the country to have all these high immunization rates.
How long does a COVID vaccine last for? I know a lot of people, they got 2 or even 3 doses of the vaccine when it came out in 2021 and 2022, maybe even in 2023, but they haven't received one since. Is there still any type of protection at all, or is it similar to the flu shot where you have to get it at least once a year?
It is similar to the flu shot because the COVID virus has continuously evolving, and because of that, it changes the way that the body responds and produces antibodies. So plus immunity wanes in the body, and it doesn't have the same effectiveness as when we received in 2021, 2022, and therefore it's not as protective as it was before. So therefore, that's why we continue coming with a recommendation of getting it every year. And for those people that have a weak immune system, the recommendation is to get it twice a year.
Of course, the flu, COVID, RSV, it all gets the headlines, but are there any other types of vaccinations right now that you are recommending to your patients as well as recommending to the city and county of El Paso?
Definitely, and this is a great opportunity to tell those young parents to get vaccinated against the tetanus, diphtheria, and cellular pertussis, the Tdap vaccine, especially when you're going to be having or you are having a newborn. We're seeing a very sharp rise on pertussis cases. The whooping cough, which affects the young infants, can affect anyone, and in particular the ones that haven't received the vaccination in a while. The Tdap vaccine, as we mentioned previously, it is combined with the tetanus, so people might remember a little bit better when they last received their tetanus shot. But if it is important that especially the adults that feel that they don't need any other vaccinations, they continue receiving booster every 10 years, along with some other vaccinations, including the flu shot. So the state of Texas has sent a health alert in regards to the number of pertussis cases that they've had. And here in El Paso, we continue to see a rising number of cases of pertussis. So that's why we're recommending, first, the people that are not up to date with the vaccinations, go and get the shots that are going to have them up to date. The young adults that are having families, every time that they have a newborn, please go get a Tdap vaccine. And the adults that perhaps they don't have any other young infants, just check your vaccine record if you have one. If you don't remember when you last got your tetanus shot, get it every 10 years. That'll protect you. And in particular, a lot of our families are taking care of our elderly, and the elderly can get the pertussis as well. And we don't want to have households infecting each other with this bacteria.
And real quick, Dr. Ocaranza, what about RSV? I know that was something that parents especially, was really concerned about when we first heard about it a couple years ago. Is that at all prevalent in El Paso in years past, and what you're expecting to see again this year?
Yes, definitely. The RSV is another one of those viruses that can affect the young infants, but also we know that it affects the elderly, and that's why they came up with this vaccination that has been proven to be quite effective. Every winter season, we would have a lot of infants getting hospitalized for bronchitis, what we call bronchiolitis. And many of these young infants, they will get quite sick. And with approval of the vaccine, we've seen a great reduction in the number of hospitalizations due to this RSV. So we continue to talk to our parents, and it is important that they get the RSV vaccination for those infants that are less than 8 months of age before or at the time of the RSV season. And if you're an adult 65 or older, go and get your RSV vaccine as well.
All right, Dr. Ocaranza, thank you so much for taking the time with us here today. All of your insight, we certainly appreciate you coming on the program.
Thank you very much, Andy.
You bet. Dr. Hector Ocaranza, El Paso City and County Health Authority.